Lars Madsen, what population do you treat?
So I work primarily with high-risk, violent and sexually violent offenders. And I usually work with them in sort of an institutional setting and also in a community setting. Usually these individuals are folks who have been placed on long-term sort of custodial supervision orders. So that means that their supervision and their incarceration has continued beyond their original sentence because of their level of risk or their assessed level of risk. And my role has been to sort of attempt to try to work with these individuals to sort of address the concerns that people might have about them in terms of their offending risk.
How risky would you say this population is?
Oh, these ones are the definite pointy end of the stick, so to speak. So many of these individuals will have multiple offences, and they'll have offending history going back sort of sometimes many decades. Some of their offending is, if you think about it, it can be very sort of planned, methodical, deliberate, as opposed to sort of individuals who might find themselves in relationships that they struggle with managing boundaries. So some of the folks that I'll be working with would be extremely high risk and in the community.
So, with someone like that, what evidence is there that they're even treatable?
Yeah, look, overall, I mean, the evidence shows within the psychological literature and the treatment literature is that the treatment does actually work for individuals, but you need to have the right kind of treatment addressing the right kinds of things. So with these individuals, because of their high risk, what we know is that they generally need more treatment than the individuals that would be considered low risk. And they also need to have treatment sort of nuanced to them in a way that allows them to take it on board and learn from it. There's often the perception that treatment is about making them a good person. It's about making them empathic, making them sort of a upstanding member of the community. And whilst those kind of goals are important and good, generally within criminogenic treatment, which is what I do, what you're really trying to do is address the things that actually about them that make them dangerous and risky. Empathy, having more empathy is something that isn't necessarily a target because we know within the literature that empathy isn't necessarily related to whether individuals reoffend or don't reoffend, and addressing that in treatment isn't necessarily a priority. Often, because of the client population that I work with, who are in many cases quite psychopathic, so they score very highly on the PCL, the psychopathy checklist. These individuals, struggle with the capacity for empathy, I think, a lot of the time. And because of that, like part of what you do as a therapist, you're trying to really sort of work with them in a more pragmatic way. You're trying to work with them in a way that kind of allows them to sort of buy into the process of change and therapy because it's in their interests, right? So, and what does their interests look like? Well, their interests might just simply be they don't want to be in jail. They don't want to have people in their life telling them what they can do. They don't want to have restrictions, that kind of stuff. So the way we might work with them is to sort of be able to say, well, you want these things in your life. You need to be able to kind of manage the problems, the things about you, they give you problems or cause you to be involved with the criminal justice system. So that their motivation is more about the sense of, well, I'm doing this for myself because I want a better life, not because I think it's necessarily wrong, perhaps, or because I want to, I have great empathy for people or the victims that I might have sort of generated because of my behavior.
So, if we reduce the risk to reoffend and then a psychopath goes back out into the world, what of that making them just a more skilled, dangerous person who's not going to go back to jail? I mean, they could still be highly manipulative, highly dangerous to people in ways that are no longer tracked by the justice system.
Yeah, look, that's true. That's true. And I know that there is a perception. There were some studies done in the early 90s where they sort of looked at, where they attempted to try to see whether, I can't remember the study off the top of my head right now, but it was a study where they were trying to address psychopathy effectively. And what they found is that the treatment seemed to make these guys worse, and they made them more risky and more dangerous. But when you kind of dig down into into the actual treatments that were provided for them, it was unconventional and unusual treatments. Sort of like I'm thinking, I'm trying to quote from memory here, but like there were sort of nature walks and all other kinds of things. So things that treatments that that we don't apply now or use now had made them actually worse. So I know also that study they actually put some of the psychopathic clients or the patients in the actual study in charge of sort of administering punishment or disciplining each other, and things just got out of hand. So I think that what the broad consensus has been that treatment that study did show that the psychopathic folks got worse, they became more dangerous. But the reason for that was perhaps because the treatment wasn't actually suitable for them in the first place. What we know now is that, yeah, I mean, there's some psychopathic clients who can become very good at manipulating the system. We certainly know truly psychopathic folks are very, very good at being able to kind of, um, sort of make themselves a bit of a chameleon in the community. They can change. They can give people what they want, that type of thing. They can be very good at manipulation. They can be very good at dishonest, being lying and perhaps getting away with it. But the nature of the treatment that we try to engage in, that people do, is much more practical in that it's actually about helping them sort of sometimes be able to make better decisions for themselves. If any person has a commitment or motivation to go and offend, then they'll go do it. But a significant part of the treatment is sort of helping them be able to recognize that some of the decision making that they make and the decisions that they make about what they want to do actually ends up kind of backfiring on them. To sum it up, it's yes, folks can do that, but I mean, in my experience, I found that 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 when you're working with someone over the longer term, you get a sense of that, and you get a sense of just how committed that they may be to the process.
And I guess what I'm kind of stuck on is that they're committed to a process to not reoffend. However, it could seem that a good psychopath could be very committed to getting back out and influencing people and manipulating people and bring people into their lives in ways that are just going to be harmful to others, even though it's not something that could put them back in jail. Is there a distinction there that you see, or is that just outside the scope of your work? Yeah. Have you ever seen like a cult leader type?
Yes.
You know, so I've seen one of these guys, and what the things that he can do are not necessarily illegal, but are
Mm,
extremely dangerous to people. For
mm,
example, he has an ostensible best friend who he's been sort of grooming for years. And this ostensible best friend is a otherwise healthy man and then gets colon cancer. The psychopath recognizes this moment of weakness in his ostensible
mm.
best friend's life, and he destabilizes this man when he's sick with cancer and convinces him that he needs to start taking dog medication because it's going to treat a parasite that may actually be the cause of his cancer. And he finds obscure sources and tells his friend that the local water system is very dangerous to him and that he should start drinking different water, and is basically just trying to completely destabilize this otherwise healthy man so that he can then manipulate him further. And it seems he's just doing it for the pleasure of it. That's the kind of person who I see.
Absolutely. I think that you're talking about sort of kind of skating up close to actual offending behavior and actually just exploiting and hurting people
Yes.
um, for gratification, for a sense of power, for thrill,
Yes.
that kind of thing.
Yes. He
Uh,
seems to take a real thrill in just seeing that he can get one over on people. But I don't think he's
mm,
going to murder anybody.
they get a gratification from that. Yeah, look, I mean, absolutely. I mean, there are certainly folks that will be like that, and I mean, I think that psychopathic personalities. I suppose that one of the things that I've found for them when working with them over so many years is that, I mean, we have this, like, their inner world is actually quite stark, is quite empty. And, we think of them as being, super calculators or predators. And I guess many of them, can be like that. But I find that when you sort of are able to glimpse into their experience of the world of themselves, it's actually quite, there's nothing really there, like, and there's no, and what I mean by that, there's no sense of, attachment to things. There's no sense of kind of connection or love or even sort of perhaps kind of gratification at achieving objectives or goals in their life. It's, it can be very fleeting. And it's, like it can a lot of the time be very, banal in terms of it's they, they feel this sense of boredom or sense of intolerable kind of irritation with, with how things are in their life. And then they kind of impulsively, do something, which, for ordinary individuals, just becomes, it's just is something that we just think, oh my God, this would just be extraordinary. I would never do something like that. But the motivation sometimes for these individuals is just simply to kind of feel something, to feel something different, to, experience something. And things like what you're describing there, could very well be, now imagine if he is psychopathic individual, then, it's about the gratification of being able to control the sense of stimulation or interest that kind of generates, or power and control that might generate for the individual. Yeah, I mean, this is the stark inner world reality, I think, that some of these guys will struggle with. And I find that, I've also worked in maximum security units where, we often struggle with very psychopathic individuals, and they sort of almost wage a war against the prison in terms of using their body and self-harm as a way of kind of punishing people and also getting back at people. Self-harm, of course, is a factor for some mental health conditions and problems such as trauma and borderline personality disorder, for instance. Self-harm for these individuals can sometimes be about self-regulation. It can also be about communicating just how painful, how much they're struggling and the help that they need. But for psychopathic clients, what we found when we sort of work with them over the longer term is that they use self-harm as a way of really just kind of getting back and punishing people and manipulating the system, to sort of gaining control, to turning the tables on people. And what's fascinating about it, when we compare this group with the, traumatized, mental health group, is that these individuals, psychopathic guys, are willing to just risk everything. They're willing to just take the risk to win, right? To win the conflict that they're having with the prison guard or the institution that they're with. So they're prepared to sort of cut off their finger, their toes, sometimes their genitals, in ways that they know the prison or the institution just has to react to. They have to take them to hospital. They have to give them care. They have to take them out of where they're actually at. And when you kind of, drill down, and when you're sort of talking to these individuals afterwards, and you say, well, what's this about? Like, why do you need to do this? Well, and it's often sort of these, what seem to be quite banal, simplistic, shallow kind of reasons. It was like, well, I had to prove a point, or I wasn't going to let them do that to me. I couldn't tolerate the fact that they had one over on me or something like that. And then you're like saying, well, it's causing such tremendous, extraordinary harm to yourself. Well, it didn't matter. Like that doesn't bother me. That, I'm indifferent to that. So there's something about, I guess, the inner world of these individuals, which I think kind of, can create, the lack of attachment, the lack of connection, the lack of love that they sometimes feel that they don't experience, means that these kinds of behaviors, these extreme behaviors can, seem to give them something of a sense of something that is gratifying, even though it causes harm to people that they propose to care about, even though it might even sort of damage their reputation and their connections and even themselves in the community. So, yeah, I mean, to answer your question in terms of, reoffending as opposed to causing harm, I mean, the goal for us when we're working with these individuals is to stop them reoffending, right? To stop them doing things that cause harm to other people. And it's also to try to kind of help them be able to sort of figure out and craft a life that has some kind of meaning and purpose for them in some kind of way, and that might just be, not getting into jail and not being under restrictive orders. And, but I mean, they'll still have these tendencies and reactions. And in relationships with people, you would expect that these would come out at different times as a way of controlling, hurting, stimulating, relieving boredom for themselves, that kind of thing.
Yeah, when you talk about the inner world, now gets at this idea of the boredom and the compulsive behavior, which I've heard about before, but not really in detail like what you're explaining here. It seems you've worked with so many over the years that you really understand, and you have empathy for these individuals who seem to not have empathy for others.
Yeah, look, I have empathy for their experience of the world, like I think that, when like I have empathy with the sense that life is pretty empty when this is your inner world, like there is no, there's no sense of where sort of normal, ordinary people would experience joy or pleasure for connections or attachments or achievements. There's no loyalty. There's no sense of working towards a longer goal to achieve something for the greater good. None of those things, although I suppose that some would say that some folks can perhaps be like that. But in my experience, I find that, like it's a very stark, it's a very empty existence. And like it is like a disability in that it actually gets in the way of them being able to sort of function effectively in the community. I think there was a study a number of years ago that kind of speaks to it. They thought this idea that if we just get all the really psychopathic individuals and we make them super soldiers, and this would be this would benefit the community or something like that. And what they found, I think, when they tried to explore or answer that question, is that those individuals that they identified actually ended up, they just kind of, jumped to the other side. They were unreliable. They were, they kind of changed sides halfway through because that was in their interests in that moment. So they lacked any kind of loyalty, any kind of commitment, any kind of sense of reliability with, with their other, the other soldiers, I guess. That speaks to something of the chaos of these individuals in terms of how they live and how they make decisions.
What do you find in this work that that satisfies you?
Oh, that's a good question. I suppose it's changed over the years. I think that early on in my career, I sort of ended up doing this area because it was kind of fascinating. It was like, there was perhaps a bit of status to this idea that you're working with these individuals and in this kind of way. I, I think that as I've gotten older and I've worked and assessed uh, these individuals with these kinds of clients, forensic clients, complex, high risk individuals, I find it interesting and gratifying to sort of kind of put the pieces of the puzzle together. Now that sounds very grandiose, but what I mean by that is a lot of the time, some of the individuals that I'll see will have committed quite horrendous crimes, and sometimes those crimes might appear quite impulsive or chaotic or something like that. And part of the role in therapy is to try to sort of be able to make sense of it. Well, what's this about, and how did this come about? So you're sort of kind of trying to work with them and sort of make sense of, well, what was it about this individual at this time that caused them to do these things in a way that allows you to then make sense of that incident, but also, them as a person and what that means for them going forward. So I find that quite psychologically stimulating and interesting. I also find the challenge of so early on in my career, I probably didn't, because I think these individuals are extremely hard to work with therapeutically. They can be extremely manipulative. They can be extremely aggressive. They can be extremely resistant to any kind of therapy. So you have to, as a therapist, like early on in my career as a therapist, I mean, you just all at sea. I was all at sea about how to engage someone, right? In a meaningful way, right? Like you can go in there and engage them in some ways that looks like things are going well, but in reality they're not. They are sort of maybe using you and using what you're doing as a way of kind of progressing without actually sort of changing. So I find that later on in my career, as I become more skilled as a therapist, I think that I enjoy the process of being able to start to engage with someone who's very, very challenging. I think that I understand them well. I mean, I'm not saying that I'm sort of special or gifted in that kind of way. I understand kind of the way they engage in therapy, and I also understand some of the levers that are important to pull to get people to buy in, which are different. I think if you're working in a regular clinical context with individuals, I think that I also, so I find that process to be, that developing a rapport and working with someone over a longer term period to be sort of, psychologically stimulating. But I think also that, I mean, it is exhausting work, and you need to kind of also make sure that you have clients who aren't in this space, and you also need to make sure you have, time away from doing these things, because it does, I think, color how you see people, how you see clients. And I think you're constantly at risk of sort of almost kind of drifting into a very sort of when you think about clients, a very punitive kind of mindset in terms of sort of working with someone. So, everything that they do is about them being a psychopath, and everything that they do is about offending and all this kind of stuff. So if you're not careful, if you work with individuals like this over the longer term, you can drift into this space which of course is completely ineffective if you're trying to work with someone to help them change. I mean, so I find that those things are the things that probably allow me to keep going on it. And what I would say also, I think over the years I've learned, is the longer you spend with psychopathic clients, the less psychopathic you think that they are. And I've worked with some psychopathic folks for sometimes over 10 years, and very psychopathic. But at the end of it, when you're coming to the end of your time with them, they become so good at reading you, I think, and giving me what I need or what they think they need, that I think of them. Oh, this is a great guy. This is like I could almost, we could go to a barbecue together and go like it, which I find is a fascinating experience for me, because I know that in literature, that's one of the things that folks comment about is it's one of the things that have been identified. The more time you spend with the psychopathic clients, the less psychopathic you think they are. Why is that? Well, I think that's because they're probably very, very much better at being able to kind of read people and give that person what they think they might need to sort of kind of lower the barriers, so to speak. So I find those kinds of things fascinating and interesting. As long as you have checks and balances in your workload and your supervision load, then I think you can do it. You can do it probably okay. But it's inevitable, I think. I think for me, anyway, for someone working with these individuals in a meaningful way, it's inevitable that that they will pull the wool over your eyes, so to speak, at different times.
Yeah, it's funny to me to hear you know the game, to talk about how they start to get one over on you, as you say. And I've heard you speak in another interview about one who came to you and said he was thinking about maybe becoming a therapist and how great it could be, which is classic. It's twinning. It's to say, I'm just like you, buddy. No, I think,
Exactly
I could learn a lot from you, and you could be like me, and we get this together.
You could learn something from me, like I could be,
Yeah.
it was fascinating. It was fun. And I don't know whether mentioned it in that interview, but so that conversation was shortly after we just had a conversation about his tendency to exploit people and watch people and figure out points of leverage for individuals that he could use to sort of manipulate or coerce individuals, right? So this is a guy that had sort of grown up within the care system and had used this sort of turn the tables on people by being able to spot their weaknesses and exploit them consistently. So we just talked about this, and we just talked about, yep, this is a strategy. This is what I do. I'm very good at it. I really like doing it because I'm always in control. I always know what's going on. It allows me to get what I want when I want it. And then we go forward to another moment where, I think I'm really going to be a counselor. I'd be really good. Like I'm giving lots of people advice that I'm, in the system with, and they really listen to me. And I think I'm very good at that. And you're sort of going, like, this is crazy. This is crazy. But once you recognize it for what it is, right, it actually is quite a funny moment, because you can actually sort of pull that out and go, oh, that's really, really fascinating. Because we were just talking about this. Do you think that there's a relationship to between what you're saying now and what you're doing there? And like, if you have a good enough rapport, and if, and this is another funny thing about working with these guys, sometimes they sort of just go, yeah, okay, you got me there. Yeah, right. Yeah. Yeah. You're pretty good. Give you a little bit of praise. You got me there. Now, and then they just, readjust the strategy for next time.
Right. Right. This is starting to get into the way that you do treatment too, right? I remember in that story that you have a sort of a shaping of the different ways that people are approaching problems, and then you kind of separate that out, put it in a chair, and you kind of talk to that other side of the personality, so to speak.
Yeah.
How does that work?
Okay. So what you're describing is, so I'm a schema therapist. So I use schema therapy working with these with severe personality disorder. I'll try to give a like a snapshot of the therapy. So the therapy uh, sort of proposes uh, that we had sort of emotional needs when we're growing up. Those emotional needs are things like safety, attunement, having an opportunity to be listened to and heard, so on and so forth. When these needs, for whatever reason, aren't met in childhood because home environments there might be abuse, physical, emotional, sexual abuse. There might be parental neglect in some way. This could be due to parents being sort of unavailable because they have their own mental health problems, because they're a single parent, because they're on drugs or something like that. If they don't get met, then what we would say is that sort of this causes sort of schemas or emotional sort of triggers, buttons, landmines, if you like, that sit in an individual. So to give you an example, so say for instance, a client who grew up in a home environment where they experienced abandonment by mum or dad for whatever reason. So that might mean that they have this abandonment schema, and whenever they kind of move into relationships and start trying to form close bonds with other people in their adult life. So what that means is that they would then, when the schema is activated, they then start to experience anxiety around abandonment, expectations that people are going to abandon them. So if you think about it, these things become like roadmaps for making sense of life, making sense of other people. Can you trust other people? Are they going to stick around? No. Then, what's going to happen next? Well, they're going to leave you. So these things sit within an individual. What people then develop in response to some of these things in childhood are coping ways of regulating their experience of this kind of stuff. And there's sort of two broad coping ways. There's avoidance, so trying to sort of block out the feeling, not feel it. And then there's sort of overcompensation. So avoidant coping methods or ways of regulating things can be things like drugs, sex, alcohol, internet scroll, like anything that distracts us, that stimulates us in some kind of way that can become addictive and problematic. So that would be perhaps an example of a maladaptive coping method to sort of regulate sort of emotional experiences. Another way of avoiding would be just avoiding things that might trigger it. So for our client who has an abandonment schema, perhaps their way of trying to regulate their experience of abandonment. Remember, they expect people to abandon them. They're an avoidant coping person, or that's one of their coping methods. They might just never get close to people. They might just avoid relationships, or they might have relationships that are just very shallow. They never commit, that kind of stuff. So they can never get abandoned, right? Makes sense. Then there's also overcompensation. So overcompensation is when folks sort of get on top of the feeling and they sometimes do the opposite of the feeling, perhaps, right? So for instance, an overcompensation strategy or coping method for sort of abandonment might be they might become massively over-controlling their partners. They might become really sort of, they might use intimidation, control, that kind of stuff to control their partners so they can never get abandoned. Now, when we work with severe personality disorder, what we know is that many of these individuals have had horrific childhoods where they have had none of their emotional needs met, and they have an enormous amount of emotional triggers, schemas inside themselves. And they have learned early on in their lives to develop sort of coping methods, ways of coping with the world and these experiences that in a sense keep them safe. So a lot of our guys have very strong overcompensating coping modes. So for instance, what would be an example of that within psychopathic clients? Well, they'd have a very strong conning manipulator. So this is a side of them that basically exploits, lies, and cheats as a way of always having control and always being able to be in charge. They might also have a side of them that uses intimidation and coercion to get what they want. So if you can't con someone, then you can threaten them. Right. They might have, typically these guys also have a paranoid over controller mode, which is a mode that's very hypervigilant for threats and basically looking out and not trusting anyone really. So looking out for people who are dangerous and then doing what they can to be able to sort of either, nullify that danger or, so get rid of it in some kind of way. And they also have coping modes, a very common one in the forensic population, is self-aggrandizer mode, which is this kind of, I'm the tough guy, I'm the king, I'm on top, like, look at me, that kind of stuff. So in therapy, right? So you're getting the model, perhaps. So in therapy, what we a lot of the time are working with are these overcompensating modes. So these are emotional states that exist in an individual that become active in therapy. So for instance, with the client that we were just talking about before, he has a huge conning manipulator mode. So he comes into therapy in this conning manipulator mode, and he's telling me everything he thinks I want to hear in this conning manipulator mode. So in schema therapy, we would use things like chair work, where we allow ourselves to sort of place these coping modes. We give them names, like this is the part of you, the used car salesman, or this is the con man, or something like that. So we kind of agree on it, and we get some rapport, and then we'll put that mode in a chair, and then we might interview it, right? So that's not them, but it's a part of them, but it's not them. It's a side of them that kind of helps them sort of, navigate the world, deal with the world, stay safe, right? And it'll have been there for a long period of time. So in this situation, what we can do, and in the case with this fellow that we just talked about, is that I put that part of him in the chair, and it just kind of went full conning manipulator mode, and just said, yep, this is what I do, and I love it, and I enjoy it, and it's great. And why do I do this? Well, and you would ask questions, for instance, like, what do you do for, the client? We'll just give him a name. We'll call him Luke. What do you do for Luke? Well, I make sure that he's always on top. Okay. How long have you been there in his life? Well, I've been there since he was 7. Okay. What would happen if you weren't there? Right. So these are the kinds of questions you would ask, and these are the kinds of answers that you might expect to get. What would happen if you weren't part of Luke's life? Well, he would be fucked. People would exploit him. People would take advantage of him. He wouldn't know what to do. He would never get his needs met. So you usually get to the function of the mode very, very quickly, right? You start to think, okay, so this is why it exists, and this is why it gets activated and large. So in a therapy room with me, or anyone like me, because these guys have massive mistrust, right? Like there's no goodwill in the world. It's like, it's a dog eat dog world. This is the mindset. Like, why the hell should they trust me? Well, they shouldn't, right? This is what the inner world is screaming at them. It's like, you just got to figure out how to navigate through it so you get what you want without actually ever being vulnerable. So once you start pinpointing these different modes for them, you then can start to kind of notice them in sessions with you. And then you can start to kind of very challenge the experience of them being active in the person's life. So, you start to kind of question whether this needs to be there all the time, question whether it has to be 10 out of 10, or, question its value in the person's life. And you can start to have these debates with this coping mode, the conning manipulator, with like perhaps another side of them where, they want a life, they want freedom, they want to be able to make choices that they, where they don't have to worry about, ending up in jail, or having problems, or, being targeted or attacked, or things like that. So you can start to develop what we call cognitive dissidence for them in terms of, the value of these coping modes. Now, I should say also, and it should perhaps come as no surprise to folks listening to this, a lot of the offending behaviors often happen in the overcompensating modes, right? So it's those modes that often are meting out punishment, or exploiting situations, or hurting people. So in a sense, we understand that the offending sort of kind of sits in that space a lot of the time. And that's where we try to work with them to try to reduce them.
And you said, you said reduce them. So I wonder, with this separating out the modes, putting them in the chair, is that the goal, is to reduce that voice, or what are you trying to do? To dissolve it, to make lasting change to it?
So we would say that the modes don't disappear. They're always going to be with someone. We all have our modes. They only become bigger and smaller, right? That's really it. What we try to do is identify what the function of the mode is, and then we start to a process of being able to kind of, create, sort of recognize or identify the problematic nature of those modes. Like when you go around life lying, deceit, punishing, attacking, exploiting people, then there's going to be negative consequences. It'll be easy enough to be able to identify that. And what we try to do is then kind of, help them start to sort of maybe recognize sort of another side of themselves, what we would call the healthy adult mode, right? So a healthy adult mode is the part of them that makes decisions that actually are, that look out for them in the short term and the longer term, right? So it's the decision to, rather than sort of use manipulation and deceit all the time, it might be sort of recognizing, well, there's some times where it's relevant and maybe, but there's some times which are problematic for me. So we want to try to kind of help them be able to recognize sort of the opportunity to make more pro-social choices for themselves that work for themselves in the short term and the longer term, linked to the goals that they might have. So the goals they might have, as I said at the beginning, might just simply be, I don't want to be in jail. I don't want to be in maximum security. I don't want to be, under this order with a tag on. I don't want to have to be sort of interviewed and assessed every week, right? That's good enough, right? So let's figure out how you can get those things without letting these overcompensating modes or these modes kind of take over your life. Because when they're in charge of your life, and this is a metaphor that we sometimes use, when these guys are in charge of the life, it's like they're driving the bus. And invariably, this bus is going to go over the cliff at some point because that's what they do. That's where they go. Eventually, they're just going to drive the bus with everybody else on it over the cliff, and your life kind of, ends up where it ends up in a difficult situation. Yeah. So we try to kind of recognize the function of them. We question the validity and the usefulness of them now in their life. We start to sort of build that cognitive dissonance that maybe they're not as useful. And we start to kind of nurture and develop a side of themselves that in a sense allows them to make better choices for themselves that don't lead them back into the criminal justice system.
And it seems the goals are the glue that sort of keeps this process together. So, as I understand, some psychopaths can be very cruel, but also very goal oriented,
Yeah,
and you're trying to channel that energy.
absolutely. Yeah, yeah, yeah. I mean, pragmatism is a number one issue, I think, with working with these guys successfully. It's like you have to be able to identify goals that are going to work for them and that they value, and they have to, and those goals have to come from them, right? So it's like, and I think that they can become extremely goal orientated and very disciplined at doing that if they have that clarity around, okay, well, if I do this and I stay the course, then I'll participate in this therapy and I'll do this stuff and I'll change my behavior. Um, but it has to be goals that they buy into. And also you have to, I mean, this is the tricky thing working with institutions and corrective services. You have to be able to kind of, um, so the initial part of engaging in therapy is being able to go, yeah, you have to be able to offer something, right? You have to be able to say, okay, if we work together, this is what conceivably can happen. And if you make promises, you have to be able to meet them. Otherwise, yeah, that's a whole kettle of fish that you don't want to open up because they'll feel betrayed by that and so on and so forth. So, but talking about the institution and corrective services is that many times I've found, and other folks I imagine who work in this space will find as well, is that you can get guys to be committed to working if they see this as an opportunity to progress and make changes and get more freedoms and more opportunity. But if the system doesn't actually sort of buy into that, or they want to constantly change the goalposts, then the whole intervention kind of goes sideways and it doesn't work. And then they just relapse back into the chaos that that probably brought them to you. Yeah.
It seems gaining trust would be so important with something like this. And in this prison environment, too, I wonder, how do you get someone to trust enough to be sort of vulnerable, to let down these modes that seem very protective? I mean, a vigilant mode makes a lot of sense in prison.
Absolutely. Absolutely. It's really tricky. It's really tricky, Brad. You have to, I mean, the first part of therapy is an attempt to try to establish some kind of rapport, authentic rapport and that just takes time. And I suppose that for me, like what it does, what I, how I approach it maybe is you have to be consistent in terms of, well, we're going to catch up at this time for this period of time, and this is how we're going to work, and this is how therapy. So a lot of psychoeducation in terms of what the process is, and and a lot of talk early on about what's in it for them, in terms of like, well, we're doing this to achieve X, Y, Z. And this is what I can commit and promise to you, right? So I can commit and promise to you that if we can commit to this and do this for this period of time, then in 12 months' time, you're going to be reevaluated. And if we are able to do this, I can commit to sort of endorsing and supporting, you progressing or you being able to have done good therapy and that kind of thing. And this is where it can go. So a lot of time is spent really sort of reaffirming with them that you're part of you are there to assist them help themselves in this situation. But your goal, my goal, is not there to kind of necessarily make them a good person. It's not there to kind of deal with their like their insomnia, or their sort of banal mental health problems, stress management or something like, although that can be important. But my goal is to sort of address the things that actually make about that person that cause the problems that get them into this situation. So it takes a long time so that's what you can do as a therapist. You can establish these things early on and work with them. But then when you're doing the therapy, like it's not like the button gets switched. It's like you're constantly also having to navigate these coping modes in the session. The conning manipulator mode, that's going to try to pull the wool over your eyes. The bully and attack mode that's going to try to sort of intimidate you or, coerce you, saying, well, if you don't give me a good report, then, bad things are going to happen. You don't know what's, so you're having to sort of navigate these modes constantly in session. And that's where I guess the schema model actually is so good at doing that, because, we start to kind of not talk about, if you come in and see me and you're all paranoid and you're questioning everything I say, and then you're kind of getting really in my face and aggressive, this is not you. This is a side of you that gets in the way. This is the side of you that needs to be in control. This is the side of you that needs to have certainty. And we all know why that side of you exists, because when you were little, there was no one there to protect you, and people hurt you. They should have looked after you, and people abused you. They shouldn't have done that. So you develop these modes to make sure that you're safe now. But here we are in therapy 20 years down the track. And, it's not necessary. I'm not here to hurt you. So in a sense, you start to label the modes, you start to recognize, and you start to try to navigate yourself, navigate past them in therapy by calling them out and using the language, but you're using the language of, this is a side of you. And you're not sort of saying, well, you're a unempathic, Hannibal Lecter-like psychopath, and you can never be cured and everything like that. So that kind of language makes it a lot easier to have discussions about these complicated sort of challenges you have in therapy, if you see what I mean. Because even as we say it now, like we all have sides of ourselves that probably, aren't always very helpful. We have a side of ourselves, and if someone says, well, you're really judgmental, that doesn't feel very nice. I don't want to be judgmental. But I know maybe if someone says to you, hey, you have a side of yourself that can get pretty judgmental. All right, maybe I do. Okay. So it's much easier to have a conversation about that than it is to sort of have this sort of language of, well, this is all of you. So I guess that developing that rapport takes a long time, and it is a complicated process, and it is a process of trying to navigate these modes and turning them down a bit in session. And I find that just takes time.
We're talking a lot about a lot of things that get at the softer side of a person, building rapport, building trust, being vulnerable. And perhaps the argument is that because these things happened in childhood, that this person fundamentally could still engage in this way. I wonder what you think of research about the brains of psychopaths, that they have perhaps just structurally different brains, and that maybe things just can't reach them in the same way.
Yeah, absolutely. So, what you're talking about, like there's type 1 I think the type 1 and type 2 psychopaths. So type 1 psychopaths, where they identify the traits and qualities of these individuals, and it seems that the way they process information is just different from sort of ordinary individuals. It seems that these individuals are born rather than they're made. So these qualities sort of don't come from tragic or traumatic or overwhelmingly difficult childhoods, right? They just sort of experience less empathy. They're perhaps more prone to be exploitative and predatory in their interactions with others. And you can see that very early on, despite perhaps good parenting contexts. And then there's type 2 psychopathy, where folks have this massive trauma history and problems in their childhood, and they also have a presentation which can be sort of very BPD, borderline personality disorder, very cluster B personality disorder, but they also have a lot of the psychopathic traits as well. And you can see these individuals maybe have more of that, the pathway into the diagnosis of psychopathy seems to be sort of a traumatic one rather than just a sort of something that you're born with. Yeah, look, it's an interesting thing. I mean, there's some debate within the schema therapy community where you sort of think you can still access the vulnerable parts in these individuals. And maybe you can. Like, I suppose that in my experience, I found with individuals who would be type 1 psychopaths, you just need to be a much more pragmatic approach. Like, there's much less access to that vulnerability, in the course of therapy. Now, I've worked with some guys who would probably fit the type 1 category. They have had, chaotic and disorganized childhoods, but they don't have the same level of trauma. And they interpersonally are very, very much that cold, very callous, and they can really, sort of will tell you about their history in terms of that. I found that with those individuals that they're just taking on a much more pragmatic approach in terms of, you're approaching, you're really kind of trying to leverage their motivation to get a better life for themselves that doesn't involve sort of the criminal justice system or whatever. And it's about being able to sort of manage, some of these coping modes, which they do have, in ways that are sort of more, that are better for them in terms of their goals. So you're less likely to access the vulnerability, more likely to sort of deal with some of these sort of overcompensating modes. Does that work? Does it make them better? Well, I've found that, these guys do tend to seem to slow down from, through, maybe that's because of therapy, maybe that's because they age out of, or they slow down because of their aging. We know that that's a factor as well. I know that what they say is they find that it's really helpful, but of course they'd say that because that's in their interest to show that therapy has been really helpful and effective. Um, but I think that this is a way of approaching it. I know that the treatment for psychopathy, approaching it in that pragmatic, clear, concise way. These are the behaviors we've got to change. This is what we need to stop, and this is what we need to do more of. Is what indicates is helpful for these individuals.
Course, this sounds like there's always a chess game afoot. That there are these
Absolutely.
degrees. Yeah, there's a lot of layers of things to be working on and keeping track of at all times. And so I'm wondering for you, we talked a little bit about how you pace yourself and you see other clients and things. I wonder what it's like to have a 10-year relationship with a client like this. Other people who I've read or talked with who are in this kind of space, they say that it can really wear on them. Read one woman who compared it to kind of slowly being electrocuted, to just be in the presence of so many psychopaths over time. What's it like for you to do this for someone over 10 years?
Yeah, look, I think it is, I think that you can, how I experience it. I don't think that it has been easy. It is easy. I don't find it necessarily, as, like being electrocuted. I think that I find that there's a liberation in being able to be really blunt, and there's a liberation in being able to be really direct. Like, I think that in therapy, I think that once you have a rapport with someone over time, you can be much more direct and much more precise. And I think it just feels like it's you don't have to, it's easier in that respect. I think that what's the hard bit, I suppose, is when we talk about some of the, like when you get into in some case, describing offending and describing, sort of breaking that down and discussing sort of their inner world in terms of how they respond to it, I think that's really quite jarring, and it can feel sort of almost, you have this. It's like you step into this sort of void where you're having these conversations about the most horrific things, and it's as if we're having a conversation about like the football on the weekend that everyone enjoyed watching. Like it feels so trivial. It feels so it feels so devoid of any kind of sort of meaning and emotion and sort of empathy, of course. And I think that's quite hard. And I've at different times have struggled with that because I think sometimes hard not to sort of also be affected by it. Like I think you can become. It's almost like you, if you're not careful, can become quite. Is it flippant? You can become quite. You can lose your humanity around this kind of stuff, and you can start to almost see it in that sort of stripped back, sort of cold, detached, sort of callous kind of way where you're talking about people's lives, you're talking about human beings and families that have suffered these things. So I think that what I noticed within myself is that's where you can kind of drift into, and I've seen it in some of my colleagues who have perhaps been in the space for a long time as well, and some of them can become extremely detached from sort of the humanity of humanity working in this space, because I think it's perhaps a protective way of doing it. Like if we just shut off our feelings and we don't try to sort of really regulate sort of our own emotional reactions to what we're describing or what we're being listened to or who we're working with. I think that it makes sense that people do this where they become harder. But I think that if you don't know that this is going on, I think that it can be sort of very emotionally taxing over the longer term. I'll just say one more thing in terms of what I noticed as well in my experience of it. I don't know whether I'm explaining it very well. What I noticed as well is what I noticed over my experience of working in these spaces is that I found myself almost sometimes having violent fantasies as well in response to frustration. And that was completely, you know, new. I'm not someone that does that, but I found myself for a period of time sort of starting to have these sort of violent thoughts and violent fantasies about some of the clients that I was working with. And, I had to figure this out. And what it seemed to be was like, I think what it signaled to me, what I made sense of it is that when you start working with someone in this space for the first time, you're often sort of confronted with a lot of belligerence, a lot of pushback, a lot of you're nothing, a lot of manipulation, a lot of turning the tables on your head. Like it's exhausting. It's hard. It's exhausting, and it does weigh you down. And I've noticed that these violent fantasies it would be about sort of hurting them, like, and these were not things that were cultivated, like in terms of like, I'm not sitting there thinking, okay, I'm going to think about this and then this is going to, it just sort of started to sort of slowly, sort of come to the surface in my mind. And when I kind of realized that like there's something about the hopelessness or the powerlessness in that moment that where you have to kind of contain yourself and you have to kind of, be this neutral, stable, warm and, accessible individual. And then, having to manage this stuff that, a maladaptive way of kind of trying to regulate the frustration or those kinds of difficult feelings was to perhaps have these kinds of violent thoughts and as well, which is that because that's what I'm listening to as well, I would say probably. And so I would say that talking to other people in the space, I mean, people have these kinds of thoughts at different times. I know, so I know that phenomena for me is not an unusual one for people working with serious violent offenders or even sexual offenders as well over the longer term.
Lars, you've talked about losing your humanity a little bit. I know you like superheroes, supervillains. It seems that the superhero and the supervillain start similar often, and then one loses their humanity and the other doesn't. What do you think we can learn from superheroes, supervillains?
Yeah, look, so constantly working with folks, I love growing up in comics, reading comics. So, like there's a natural affinity there that started early on. I don't know. I mean, I kind of became much more fascinated with the release of the Joker movie. Remember the original Joker movie, which was about 10 years ago, I think now. And what I found that really was interesting for me was really the character, the Joker character, really meant well. Like he started off as a character that was weak and feeble and wanted to, loved his mum and wanted to be liked and wanted to make a contribution and things like that. And then he had some traumatic experiences and he kind of switched into, I think, you could see all these overcompensating coping modes that take over. So I try to use sort of discussing, superheroes and supervillains as a sort of way of helping folks sort of get the idea of schema therapy. Because, and let me explain. So if we look at superheroes and supervillains, a lot of them, all of them, I think, all of them come from experiences where they've had trauma, childhood trauma. Like Batman, he's watched his parents gunned down in an alleyway. Bane grew up in some kind of prison where he was, excluded and punished. Even Spider-Man, he had a trauma experiences that sort of put him on his trajectory to do the things he did. And what we can see in those stories is that the trauma that the trauma happens, and then that changes them. And what we see, for instance, with Batman is that he develops sides to himself. He develops ways of coping with the world that, in a sense, almost are an overcompensation for the trauma of being isolated and alone. So he becomes this vigilante, guy that's hunting down bad guys and doing good and that kind of stuff. And and the same for the supervillains. We see the Joker movie that there were these bad things that happen in childhood and these overcompensating modes, same modes perhaps, develop, but they become supervillains and bent on the destruction of humanity or Gotham City or wherever they are. And the fascinating thing about these stories is that what separates superheroes from supervillains, there's one thing that separates them, right? There's one thing that separates them in the path, which I think is just it's beautiful because it speaks to something about the experience of, I think, a lot of the clients that I work with as well. The one thing that separates them is, you know what that is? It's love. It's love. So all the superheroes receive love in their child, genuine connection, warmth, attunement, and love. And then they had their trauma, and then they became who they were. And the supervillains didn't, right? They didn't experience this love, right? So then they became the bad guys, right? And when I work with guys in the criminal justice system with these individuals, like it mirrors this experience. Like a lot of the guys who end up being the baddest of the bad never experienced any love. They were often they were the ones that were completely let down by everyone. And that's and is that relevant to who they become? Absolutely, it is. Absolutely. And in a sense, it's like there is no restraint, because, well, why should I show empathy, love, kindness? Because they never happened to me. Oh, fair point. It didn't. People that you were let down. So I find that these stories, superheroes, supervillains, tells it in a simple way, in a way that's accessible to a lot of our clients, and in a way that kind of also makes sense for them, and a way that also sort of takes away the fact that the labels that people get for being, you're bad and you're no good. It makes it easier to understand and comprehend in that. I think it also provides like a bit of a key to the antidote for it, which is, what is it for a lot of folks? It is love. It is kindness. It is compassion. It is sort of helping them be able to figure out their life and change the things about themselves so that they can become, if nothing else, more functional people, in that they don't end up creating chaos and returning to or hurting people and the settings that I end up seeing them in.
Well, Lars Madsen, that is a unique take. For those who want to learn more from you, before I ask my last question, where should they look for you online?
Yeah, look, so I have a podcast as well called Beyond the Crime, the psychological analysis, and that's where me and my colleague Rob Brockman and Shay Addison, we sort of use schema therapy as a way of making sense of particular kinds of crimes, sometimes cases, that kind of thing. We use these concepts to try to break it down and make sense of it. So you can have a listen to that. The other thing that I have an online course which you can sign up for, I think, any time of the year. It's called A Hero's Journey, the Forensic Schema Sessions. It's on schema therapy online, schema training online. I think I'll send you the link, Brad. So this is a 6-week course where you can see me doing schema therapy with a violent client and going through the process of working with him towards some kind of resolution. So it has me actually doing the therapy, and then it has Shay Addison, who provides an analysis of what's going on and why it's going on and why it's necessary in prior to the actual clip. So it's actually a very, I think, quite a well-rounded sort of educational experience. That's what we wanted to make it. But we also wanted to make it to be like a little bit of a story. So you see the beginning, middle, and end of therapy with someone. So you get that sense of closure with it rather than just seeing techniques or lectures on why we do things and what we do.
Great. We'll put links in the description for everybody to check out. And Lars Madsen, my last question is that we've talked about seeing these different sides of ourselves in learning about your technique of therapy. And one thing that I've been hearing more from people about is how hard it can be to forgive yourself. What do you think we can learn from your technique and your experience about forgiving ourselves?
Oh, look, okay. So I'll try to answer it this way. Like, I think that I would understand the challenge with being able to forgive yourself is that there's a side of you that struggles with being able to do that, and there would be some kind of conflict within yourself. There'll be a part of you that you can't forgive yourself. Why can't you? Wouldn't someone be able to forgive themselves? Well, maybe there's a sense that they feel that if they do that, then they'll make it. Whatever it is that they did, they're going to make it okay. They might do it again or something like that, or they might have some. So I would say that there's maybe a mode that's saying that you can't forgive yourself, and I would be interested in and curious in why that mode, to explore that and to differentiate it a little bit. And then I'll kind of be also curious about the part of you that wants to forgive yourself in terms of why that would be important and why that would be necessary. So yeah, I don't know whether I've answered it particularly well, but I think that's how I would kind of make sense of it.
I like it, letting those two sides have it out and exploring it.
Yeah, exactly. You could just allow yourself to sort of have two chairs and then have one part that just kind of, doesn't want to forgive, and the part that actually does want to forgive. Because if you're struggling with that, then there's definitely two sides to that experience.
Well, Lars Madsen, for taking this interview with me, sharing these interesting ideas, and for the work that you do, thank you so much.
Thank you very much, Brad, and thank you very much for having me on your podcast. It's a huge buzz for me to have the opportunity to talk to people on the other side of the world, no doubt, about some of the work that I do. So I hope it's helpful for your listeners, and thank you very much for having me on.
To help raise awareness about narcissistic abuse, please share this video. It helps a lot.